Good evening, Dr. Fearmonti. How are you?
Good. How are you? Good to see you.
Well, in the midst of the coronavirus, thank you for taking our podcast. Brave is really thankful for you as one of our medical advisors and Brave doctors. How are you doing in the COVID-19 situation, Dr. Fearmonti?
Well, good. It's trying times. We're all pretty healthy here at the office, and we're limiting access to post-operative patients only. We did open our clinic last week to minor lacerations, abrasions, things that can keep patients that just need a couple stitches out of the ER. So, trying to limit our exposure. But we're lonely, isolating. We all miss each other.
Yeah, this is the most human contact I've had, except I saw a neighbor walk down the street today and I said, hey. But this is our first broadcast as Brave, and Brave set out to help plastic surgeons and, more importantly, the patients with breast cancer reconstruction restoration options. But for now, I think we're kind of pivoting to think about a broader audience around patients that are immune compromised, breast cancer patients, any kind of cancer patients, because I know you trained at MD Anderson, one of the best cancer centers in the world. So if you had any tidbits of advice, Dr. Fearmonti, that we can send out to patients, I'd love to hear from you.
Yeah, well, there's kind of two things I've seen come across my radar. I help with the reconstructive aspect. We have a couple patients that have just finished their chemotherapy, or that have just gotten a diagnosis of breast cancer, and their question is, when can I have my surgery? So it's tricky. We're under the guidance of the Texas Medical Board here in Texas. But also, all of our local hospitals, the governor's stay-at-home order. What that means is if the order was very vague, but if something can be delayed so as to not use supplies, or expose patients and hospital personnel to COVID-19, that it should be delayed. So that's tricky for cancer patients. So we have a couple patients out there. We've been using Society of Surgical Oncology, SSO, which is our governing body when it comes to cancer cases, their guidelines. So they're recommending early stage breast cancers and those that are receptor positive, if we can, to postpone and delay surgery until we've had our peak and we're on the mend and we have repleted our personal protective equipment and supplies. When it comes to patients that are actively getting chemotherapy, they're also at risk. I have a couple patients that have had their chemotherapy interrupted, which is
that's what I was going to ask. Yeah, that's really scary.
And they're also prone or really high risk for any kind of respiratory infection. So they're really super isolating, even from family and young kids that may have been exposed, be silent carriers. So it's really kind of shaken the world upside down. We hope when we do get to open our ORs, which we're hoping, May 9th is now a tentative date.
Wow.
We're going to deal with active cancer patients first, and then our prophylactic patients. But currently, active cancer, invasive cancer is being operated on, but they're also recommending lesser procedures. So I have a couple patients with invasive cancers, and rather than flaps, we're putting expanders and implants in, things that take less time, use less staff and hospital equipment. And again, as a means to temporize. But we really hope to get back on track by the beginning of May and start going through our list of patients that have been so patiently waiting and affected by this.
Thank you, Dr. Fearmonti. We want to make these really small clips every night we'll be doing. If anyone has questions for Dr. Fearmonti, they can email bravecoalition.org and I'll send them over. I'm sure there's so many more questions, and we probably will start doing podcasts where Dr. Fearmonti, you and other experts like yourselves will come on and just talk to people, because they're trying to stay connected, and we don't want to over socialize the internet because so many people are just coming at us, but we really want to be there for people. So Dr. Fearmonti, it's 5:30, probably time for you to leave the office and get home. Thank you very much. You're excited to be at the office. I would be excited to be there because I have 3 dogs barking in the background. So thank you, Dr. Fearmonti. We'll be back in touch. Good night, everyone. Good night.